Much.
Thank you very much, and indeed it's a pleasure to be here to represent the World Bank and to express our commitment to this partnership and to this campaign, which we think is very important. It's also a pleasure for me for a personal reason. Many years ago, as a young Peace Corps volunteer traveling through the high mountains of Peru in 1970, I found myself in Huaraz on May 30th. On that day at 3:30, a major earthquake of catastrophic proportions hit that region. Indeed, this beautiful city comprised of houses that were 3- and 4-story high, made of adobe with very narrow streets, virtually collapsed on top of the some 30,000 people that were living in that city. I made my way to the hospital. I survived and decided that I would try to volunteer my services. The good news was the hospital was made of cinder block, and it was made in much stronger specifications than these adobe buildings that were the rest of the city. And so there I worked for the next 4 or 5 days trying to help people as they came in with broken legs and crushed feet and so forth. But clearly the hospital was understaffed, and more importantly, many of the medicines that had been in the hospital were destroyed as part of this. Shelves fell down, morphine was broken and spread all over the floor. The electricity supply, which was running from a generator, was faulty, and so operations that needed to occur couldn't occur. So it's for that reason that I think this particular initiative is terribly important, because if retrofitting had occurred or if better standards had been introduced into that hospital, I think many more lives could have been saved in that circumstance. Let me tell you the 3 things the World Bank is doing in this particular area. The first is, as John mentioned, we're working with the Global Facility for Disaster Reduction and Recovery. This is a trust fund that is a $70 million trust fund that I'm happy to say the Swiss government is a key donor, along with 9 other donor countries. And basically, the purpose of this is to fund integrated disaster risk considerations of the kind that Princess Zara mentioned a little bit earlier, that the AKDN network is undertaking in Pakistan. Basically, we've dispersed some $4 million annually in this program precisely to do these kinds of same studies. Secondly, as part of our overall health, population, and nutrition lending, the World Bank is, as part of its health systems, we're working very closely with the WHO and the network here in order to be able to design hospitals in ways that are compliant with all the risk mitigation procedures necessary. So we're doing about $1.5 to $2 billion worth of lending in this area, a substantial portion of which goes to eventually health systems and hospital construction in modern ways. And the final thing we're doing, of course, is we are almost always first on the scenes to develop long-term recovery programs after major disasters, the tsunami, for example, in Indonesia. In fact, our folks have calculated that some 10% of World Bank lending over the period since 1984 has gone to disaster reconstruction. Hopefully, as we think about health systems looking forward, we can begin to put in place some of these long-term construction facilities that will allow hospitals to endure the kind of earthquake that we saw in Peru. So I'm pleased to offer our commitment to this effort and wish you and the campaign the best of success.